And good evening, everyone. This is Sue Prentiss, and we're really pleased everybody could join us tonight to talk about the community impacts of COVID-19. I'm I'm joined by an esteemed panel here from the Upper Valley. So we have joining us tonight Sean Mulholland, who's the city manager here in the city of Lebanon. We have Josh Toohey from Salt Hill Pub. We have Kurt Jakes from West Lebanon Feed and Supply. And we have Tracy Hutchins from the Upper Valley Business Alliance. So we're, the purpose of having this conversation tonight is that we know that we have a global pandemic that we're facing on a local level, that we've all felt an impact from this, and it's changed. It touches every part of our lives, and it's actually changed how we live our lives and how we do our business. So we thought it was important to have a conversation and tell you a little bit about what we're thinking here in the city and how we've not only prepared for this, but are continuing to prepare to respond to this, both operationally and as a public health emergency, hearing from members of our business community on what the impacts have been for them, and how they have maybe had to adapt to deal with this. And at the same time, and then we'll hear from Tracy about the kind of the perspective from looking at the whole of the Upper Valley. And certainly we always have time for questions and answers. So I'm going to kick this off. Let's see. By talking first a little bit about the health and safety of the community, and Sean is going to join me as part of this conversation. So important to note, as of August 13th, we have 420, so in the state, we have 422 deaths. We have 2 deaths within the last 24 hours and 34 new cases. So this is not over for us. We are still, we're still in the middle and we're still managing it, but the Upper Valley, specifically Grafton County, and in this area, we saw the first cases in New Hampshire. And when they first emerged, I was down in the Washington, D.C. area at work and visiting my daughter. And here I'm learning on the news about the first cases in New Hampshire being in Grafton County near my hometown. And one of the things I thought about right away was, okay, I wonder, I'm sure that they're standing up our public health emergency preparedness capacity, and as a city, and then joining with the region, responding to this. 1 case, 2 cases, we have a plan to manage these public health emergencies. So, and of course, what had happened back at home, because I'm always monitoring the emails, was that indeed the city manager and the fire chief, who's our emergency management director, had stood up our multi-agency command center, we call it a MACE. They had community leaders from throughout the Upper Valley that were part of this command center that was hosted at the Lebanon Fire Department. There were daily briefings for the city, for city officials. We could call them situation reports. We were regularly updated as to the status of this public health emergency that was happening in our city. Because first you do no harm. First you take care of the emergency, and then you're thinking about, layered on top of this, how this is going to impact the community, what your continuity of operations will be. Back in the mid to late 2000s, when we were building out the public health emergency preparedness capacity in the state, we had spent time talking about and planning for that continuity of operations. And part of me was thinking, how long can something like this really go on? But we planned for it, and here it is, and it can go on for a long time. So I just want to kind of plug over to the city manager, who, before he came to us, he did this kind of work in Allenstown. Have him talk a little bit about the city's initial response on the public health side.
Like Councilor Prentiss stated, this was a response that was not just local, not just the city of Lebanon, but the way we respond to a public health, we do it by region. Most other emergencies, we do it by community. But this, again, is a public health situation. We have plans that were put into place quite some time ago, and those were funded with bioterrorism funds as well as funds to deal with H1N1. And each community in the state is part of a public health region, and we are the Upper Valley Public Health Region. So at that particular time, both myself and the town manager in Hanover requested activation of our public health region. We were the first to do that, first region to be activated to deal with the situation as it was developing here, so that we could have that multi-agency coordinating entity work together to have all the communities on the same sheet of music, sharing resources, sharing public information, putting that information out to the general public. And that's exactly what we did. And we followed that plan, and it actually worked quite well at the local level in accordance with the plan. There were some rough areas when it came to coordinating with the state, because they weren't exactly operating on that same level at that particular time, because nobody had activated yet. And we were the first to do that. And since then, we've been operating on that plan, and we've been developing and adjusting as we've needed to, based upon the changes in the COVID-19 pandemic.
Okay, perfect. Thank you. So I'm just going to go back here and share my screen again. So we move from that initial phase of responding to the more day-to-day operations, in city government and in local businesses. So some of the things that changed for us, and probably those of you that are watching or will watch this later, remember that it went, I remember like every morning, I live right off of Seminary Hill, and I hear the cars going up and down the street. All of a sudden there were no cars. So we adapted once a decision was made that we were going to stay at home, that, as a community, we had to adapt, as our families, but city government and businesses were impacted by this. So from a city government perspective, and Sean can shed a little more light, but I'm going to talk about some of the things that I observed, as well as, then we'll talk about some of the concerns that we have. We were able to flip the model and put protections in place so that city staff, their health and well-being was protected, that essential functions were still in place. And so that, for example, the fire department and the police department were still responding to emergencies, but the personal protective equipment that they used previously, they basically escalated their level, up to the top, and were using this on every single call, because we were still trying to assess what the presence exactly was, not just in our community, but throughout the region. So any of the functions that could take place online took place online. People that needed to be in City Hall were brought into City Hall, and protections were put into place so that the access to the public was changed. Sean, do you want to talk a little bit about that?
Yeah, we had to adapt really quickly without really any plan on how we would actually do that. Everything from registering motor vehicles to doing marriage licenses, to basic response for every function of the city, human services for those applying for welfare. All of that had to change very quickly, and require a lot of innovation on staff to do that and develop new ways to get that done. Simply saying we're not going to provide the service is just not going to work. Some communities actually did that. In fact, some of them are still closed, and they don't provide certain services like motor vehicle registration even to this day. That was just not acceptable here. We had to find ways to do that, and we've been able to provide all those services to our residents. Now, granted, some of them are more difficult to do. You have to mail things in perhaps, or drop things off in a box, and it may take a little longer to get that response to register your vehicle or get a dog license or a marriage certificate. But nonetheless, we provide those critical services. And then we had to adjust again when the economy opened up again. The state relaxed some of its regulations in May and allowed for restaurants to reopen under certain conditions. And it was clear that most of them were not going to be able to operate under those conditions, at least not operate effectively. And that's when we started to do the things that you see around the green out here, in terms of closing a city street down and a parking area, working with those businesses to develop plans to allow them to put up tents and provide the services that we all like to have, but also to keep people employed once again and keep those businesses operational. We also use the green and other spaces to allow yoga programs, private sector businesses to come on the city property to do that. And they're still doing that to this day, to be able to use that space. Anywhere we've got a space to do that, we're allowing people to do just that, so they can keep providing those services, keep those businesses active, and keep people employed in the city.
Okay. So what were we worried about? As a city councilor, first I was most worried about the health and safety of our community. But as I said earlier, I knew that we had this public health emergency preparedness capacity, that it would be, a command center and a response would take place and these activities would be coordinated. And that's exactly what happened. Um, Centered here, but collaboratively throughout the region, which is one of the most important parts about that. So the health and safety, the management of the emergency is being taken care of. But the next piece of it is thinking long term. So if people are out of work, if they're not buying cars, if they are, they're not shopping or shopping, say, in the way that they were previously, as activity started, slowing down or even stopping, what was that financially going to look like when we are, as a state, we're so property tax reliant. Our sources of revenue are, our non-tax related revenue is almost unheard of. Tax related revenue is really where we're at. And things were being compressed, or our ability, the revenue to come in was definitely being compressed by COVID, and understandably so, because the first thing we had to do was no harm. We had to try to stop the virus, flatten the curve. So when you're property tax heavy or reliant in a state like this, the impact is not as immediate. And part of why it's not as immediate is that there were federal programs like the CARES Act that pushed money out into the state, as well as the state took action. So there was money, that $40 million that was set aside that came to cities and towns. And I believe Lebanon got a little over 300,000 of that to, basically to help support operations. But at the same time, there was some payroll protection, unemployment benefits. There were funds that were flowing to, to stimulate and to also to keep, keep I would say the area operations, support them in this time when things had almost come to a halt. So there were some stopgap measures financially in place, which, brings up the matter that the longer term impact of this has really yet to be felt. As a city councilor, I'm worried about what's our revenue going to look like? How are we going to continue to operate and provide services as a city? What does this mean on top of that to those that, obviously that live here, but those that have businesses here and have employees that come here? What does this really look like? So, and I'm going to turn to Sean in a second, but one of the things that we knew pretty early is that we immediately started watching our, tax bills were going to go out. So we knew like July would be the time that we'd have a sense of what this was really going to look like for the city. But at the same time, we had some protections that were put into place, and so that might mitigate the immediate impact of this. And then the city manager started working with the council and made decisions. He looked at the current operating budget and said, here are rescissions, places where we can reduce the budget and, not spend money. This is, midstream in a year when a budget's already been adopted, preparing for what could happen. So immediately these kinds of actions were taken. Sean, I'm going to just turn it over to you for a second to talk about that.
We made $891,000 between in budget rescissions from the month of April going into May, to build a reserve to deal with potential shortfalls in revenues that come in. The city has an obligation to raise the taxes, not just for city operations, but also its portion of the county tax assessment and the school district. We have to raise that money. If there's any shortfalls in those revenues, the city is required to pay the full amount to the county and the full amount to the school district, regardless of how much it actually brings in. So the shortfall, the city has to take that in its operating budget. So we built immediate reserves to deal with that eventuality if that were to occur. And we still have those rescissions in effect for right now, that nest egg of $891,000 should we need to fill revenue shortfalls. Fortunately, the property tax levy for the first half tax bill has come in at about 99.4%. So it's very high. It's actually higher than the previous year, the amount of taxes that came in. So that's really good news. But we don't know what's going to happen in the second tax bill, and we don't know what's going to happen in terms of a potential other shutdown of businesses. So far, we don't have a surge in our area, but the concern is if we do we may have another shutdown, and that may cause further problems with property taxes.
Great. And all throughout this part of the, of the response to COVID, it's more of where we're thinking about the continuity of operations at the city level and then moving on to the businesses. As a city councilor, I was informed, the city manager and his staff kept us informed every day as to what was happening, and not just the situation reports, but we did meet regularly because we had to talk about these, rescissions and what was going to happen. And at first, we didn't have an emergency order that allowed us to actually meet and conduct and do our business in the way that we do now, which is through Zoom. So there were, a few times where we had to actually come into City Hall, socially distance and do our business until we had people aboard to do this work outside of the City Hall press. So I want to kind of sort of shift away from talking about the city's response and talk to members of the business community that were impacted by this. And I think I'm going to start with Kurt Jakes, West Lebanon Feed and Supply. Talk a little bit about, tell your story, what this has been like for you, what the impacts have been, and what you think about the future and you're hopeful for.
Well, thank you. I think one of the things for us, it's been, we're unique in the fact that we have a business that's somewhat insulated from things like this. People need feed for their animals. They need food for their pets and whatnot. It's been a struggle right from the beginning because we were hoping that we'd have more guidance from the medical community as to how do we handle this. We developed our own screening procedures. Our employees are required to call before they enter the facility, and a manager has to come out, ask several questions and take their temperature. We got through that. We set up our store. We're actually one of the first businesses in the community to have a curbside service available. And we did that, and that was well received, and a lot of people had used it and are continuing to use it. Thank God, 3 years ago, we worked on this new program called Goober Pick, which is a retail delivery system. We have a system set up at our store. We have one in Enfield, and we have a third one that's we hope to deploy in Lebanon as well, giving people a safer opportunity to be able to pick product without the worry of social distancing. We sanitize every time we fill. It's filled within 12 hours. But it was a wake-up call for us, and for us to be able to come up with ideas and thinking outside of the box. The biggest problem in retail is online, and what's happened is it's forced a lot of people to rely online because they didn't want to go outside of their home. Goober Pick is coming in very, very good because of that. But for brick and mortar stores in our community and across the country, they're hurting. They are risking losing business. And the thing that we're concerned about in the fall, when this next phase comes through, or even after it's being developed, what's people's buying habits going to be? That's the big concern. We've fared fairly well this year in terms of our business from year to date. There's things that we saw that were different, like people buying garden products. I'll give you a good example. May is our biggest month for vegetable seeds. We sold all that we did last year before the end of April. We were able to get some more, but the problem is the suppliers, the seed companies, are already into next year's stock. So you think that's an issue that we weren't able to get much now? It's going to be worse next year. So there's things that are matriculating down. And about 5 weeks ago, was the first time we were having problem getting product. We had one of our major suppliers came into us and shut us off because they said, if we're not your primary supplier, we're done, because we can't fill everybody else's needs. So we're just going to take the top customers, and then you're going to have to fend on your own. Well, this past week they did come back, but it's scary. And so here we are sitting with a retail store. If we can't get product to sell, that's going to be a problem. So it's not just dealing with the local issue, it's the global issue, and it's getting product to sell to make sure we meet the needs of our customers. But I think the biggest thing is we are resilient, and we are very innovative and entrepreneurial. We found ways to make things work, and we set up our store so there's a line that you have to follow. We've got the sneeze guard. You've had them in place right from the beginning. One of the issues we had, and I talked to Sean, and I appreciate it, the fact that the city has put in the mask ordinance, because what was happening, we requested people in March and April, and then shortly after we made it a requirement. And people would come in and we'd say, do you have a mask? If they didn't have one, no. Would you mind wearing one the next time you come in? Just a request, because that's what we had on the door, was a request. We had a lot of pushback. We had people that dropped the F-bomb and said, I'm going to go somewhere else. And they went to competitive stores that didn't enforce it. And so what's that say? It's not a fair, safe, responsible playing field. And I applaud the city for following through with this, but it's a struggle. And I feel bad for, and I'm worried about people like Josh, who I won't take the thunder out of his sail, but other friends of mine who have restaurants. What's going to happen when it gets cold? I think business probably is a little bit better now than it was in March, certainly, but we have to work together as a community. We have to work together as business to business, but we need partners like the medical centers like APD and Dartmouth to give guidance that we didn't get, and even to the point of coming up with recommendations and coming in and saying, okay, we just want to see how you're doing. What's the practices you have for your employees to keep them safe? What's the practices you have for your customers to keep them safe? And are you following it? It's people are getting complacent, and I'm worried about that.
Okay. Well, thanks for sharing, Kurt. And I think some of the at least the good news as of last night, and one piece of good news is that we have passed a mask ordinance. It's good for the health of the community. I think it backs up the businesses when they're trying to enforce this in their locations, because you're worried about the health of your employees as well as any of your customers. All right, and certainly we'll have some more questions for you, but we're going to go over to Josh right now.
Hi, thanks, guys. Thanks, Kurt. For our part, Kurt nailed it. Our very biggest fear is future dining habits and comfort level of people as the weather turns, and depending on if any other new developments come out with COVID-19 situation that aren't good news. But back to the masks, I will say I'm happy to say that a vast majority of our guests, even from early on during this situation, were pretty good about the encouragement to use masks. And we used literature from some of our key vendors and the New Hampshire Lodging and Restaurant Association, and put it right up front center. Just put here's the encouragement, here's why. Please assess yourself. If there are any symptoms that you think you might be suffering, if you've had contact with anyone who might be sick, please, you shouldn't be out in public. Please, stay healthy, stay safe, so you can join us another time. And now that the mask ordinance is in effect, because I think we had already adopted this really courteous, strong request of people who wear masks, it's been a very minimal change in the last today. It's been one day. But bravo, City of Lebanon as well. I would agree with Kurt on that. As far as Sue, as far as our story, it's been tough. We're certainly down over prior year. I think most people in my shoes would say that right now. It's not a secret that we have one restaurant in Hanover that we chose not to reopen. we're currently, and one silver lining of that is in Hanover, every employee that we had there that wanted to work, we have already, we've kept them employed in Lebanon or West Lebanon. So that's a good thing. Overall, staff-wise, we're still at about 75%, which is a challenge, but some of them are totally, they may not be comfortable returning to work because of COVID-19. They might not have a childcare solution. I can understand all of that. Some silver linings, the main thing I would say, it's not just the support that we've seen from friends and guests, the city of Lebanon, fellow business people like Kurt, at the end of a long day that didn't go so well, that kind of stuff really helps you get through. I'd like to also thank just Sean and the city of Lebanon from very early on. We were just talking, communicating via email, and 5 minutes later he was in the pub saying, what do you need? And I know it's not just Sean, but he was one of the people that I worked with closely. That just creative thinking and quick action. We really appreciate the use of the front parking area. And I know Robert appreciates Port Street as well. For adaptations, we pretty early on did a lot of the things that Kurt was talking about, kind of a daily staff wellness check, questionnaires, thermometer, temping. We heightened and enhanced what I already thought was a good hygiene procedures in-house, but we certainly got a lot more tools, a lot more literature to make sure that we were going the full 9 yards there. Obviously, as is mandated, every one of us, I'm in a room alone by myself, but every one of us while at work here, we're all wearing masks the entire time. So we're trying to just do things right. We've also kind of had to streamline a lot of things we do. We're in the process, and it's taking longer than it should, but we're trying to reduce our menu, find a way to try to produce what people want, but with fewer people and fewer resources at hand. We are enhancing our to-go, the curbside pickup, online ordering is fully established now, and we're working on a delivery program. We've got about 23 people full-time right here in Lebanon right now. They're all local. We have regularly extended offers out to everyone else who for whenever they're ready to come back. We have them. We're nothing without the people that we work with. Biggest concern, we're gaining ground now in large part because it's been a nice summer. We've got a lot of outdoor seats. But the biggest concern is we can't predict dining habits, especially as the weather gets cold. We're going to keep the tent out a while longer than originally talked about. We're getting some walls on the tent and researching, tent heaters. Again, it's hard to say how much that'll move the needle with diners if they're not comfortable coming inside, but also then you're asking them to sit outside in November. So we'll see about that, but we are optimistic. Hopefully also we don't go backwards with any COVID news. We don't go backwards with any restrictions against dining in. That'll be really tough to try to struggle through a second time, but we'll do what we got. Yeah. Again, thank you, Sean. Thank you, Sue. Thank you, everybody in this community. You guys have been fantastic to us. We appreciate you.
You're welcome. It's great to work with you and to Kurt and Tracy. The Upper Valley is a small place, and what we do in one community impacts the entire area. And I think that that goes for the good times as well as the difficult times. So, okay. Thanks, Josh, for sharing your story. And now we're going to go to Tracy from the Upper Valley Business Alliance.
Hi, everyone. For those of you listening, if you're not familiar with the name Upper Valley Business Alliance, we are the result of a merger last year between the Lebanon Chambers of Commerce and the Hanover Chamber of Commerce, and our new name is Upper Valley Business Alliance. So two old friends, I like to say, that came together to better serve the needs of the Upper Valley. It's been a long haul for us, for all of our member businesses, for sure. When this all began, we had so many businesses that were just devastating because in the course of just a week or so, everything came to a halt. We helped to respond. We partnered with Sean in the city of Lebanon. We held a press conference for businesses to talk about what the guidelines were and what we knew at the time. And when I say at the time, it was because it was really changing on a daily basis. Um, what was expected, what businesses could do, what they could not do, what the shutdown was going to involve. And it was just difficult for so many of our businesses. We started working on supporting restaurants. We called all of our restaurants, um, not just our membership restaurants, but all that were available in our region. And we put together a list of what they were offering. Some were doing curbside, some were doing delivery. We called it Upper Valley to Go, and we started messaging that out through our social media channels. We partnered with the Valley News, who put some of that information in the newspaper as well, so that we could try to encourage support of the community for our restaurants. We then turned to our retailers and did the same thing, a list with our stores as to what they were able to do. A lot of different changes there. Like Kurt said, he was a leader in being able to offer curbside. For some of our businesses, that had never occurred to them, so that was very new. And we tried to get that information out as well, and to encourage people to continue shopping locally. We have done a lot with messaging. I was on calls weekly with our federal delegation, Senator Shaheen, Congresswoman Custer, with our state officials. I'm still on a weekly call with the Business and Economic Affairs Commissioner, Taylor Caswell, who updates myself and other chambers around the state weekly as to what's happening. And we tried to push that information out to our businesses as quickly as we could. So as the different programs were being announced or changed, because they were being changed quickly and often, from the SBA on the PPP loans, on the emergency injury disaster loans, or EIDL. And then, of course, as things started to progress into May, the CARES Act was released to the states, and New Hampshire received $1.2 billion. And then New Hampshire had funds available for business profits as well. We early on, we were working, trying to encourage people to do face masks. When this all began, and in May, when the reopening started, the state was first allowing businesses to order free face masks. And you had to pick them up at the DMV, which for us is in Newport. And for some of our businesses in our area, that's almost an hour to an hour and a half round trip to go pick up face masks. So we began coordinating, taking the orders in and doing a bulk ordering with the state. We had to receive special permission from that. We worked with Sean in the city of Lebanon and the town of Hanover and the town of Enfield, who would take turns picking those orders up for us with their vehicles, and then making sure that the businesses received those. Unfortunately, that program did not last long with the state. I think they caught on pretty quickly that there was more of a need than they could provide on a long-term basis. And so they stopped that, which was a shame. And then just recently, partially in part to a conversation Kurt and I had about encouraging customers to wear face masks and the issues that he's brought up. And it's something that we had heard from our other members, concerns over the safety of their employees, concern over liability as well, because that's a brand new thing. There is no safe harbor legislation for businesses right now. So if someone was to claim that they contracted COVID at a place of business, the law right now is very, very loose as to what that might look like in terms of litigation. And so we had an opportunity to join with a statewide effort called Mask Up New Hampshire, and help to bring that to the Upper Valley by working with the Rotary clubs in Hanover and Lebanon, where the masks were being distributed. And this last weekend, we handed out 3,300 masks at the parking lot behind Jesse's in Lot 9. Great effort, lots of positive response. And the 2 Rotary clubs raised over $2,000, which is going to go to Haven and Listen. So that was a terrific project for us to be involved with. We were able to involve our Upper Valley young professionals as well, and just great. We were happy to do that. You know, this has been an interesting time. I know, Sue, you had asked me sort of what I'm seeing in terms of silver lining and concerns. You know, this situation doesn't have a really good pattern. We have some businesses that are still doing pretty well. You know, any business that's involved in entertainment at home or staycations or home renovations, they're still doing, you know, fairly well, a fairly brisk business as people are staying closer to home. So, you know, we have a business in our membership that is a roofer, and he's had a great year. Landscapers, builders, people that sell pools and spas, they're doing fairly well. And then we have other businesses that have just been devastated by this whole situation. And, you know, some I'm not sure if they will recover or not. So it's really kind of a difficult place to be for businesses. Uncertainty. We don't know what the fall is going to look like in terms of a resurgence. We don't know what the winter is going to look like or when there's going to be a vaccine. So one of my chief concerns is, you know, we've had many of our businesses access the relief funds, both federal and state. But the thing we really need to remember is those relief funds were there to provide relief. They did not make our businesses whole. So I have had people call us, business people, saying, I've received the PPP, I received the New Hampshire Main Street Relief Fund. Is there anything else? And that concerns me greatly, that as those monies that they used to cover their losses when this first started are used up, what will happen then? Will things be back to normal so that they can resume business as normal? And so that's a concern, I think, going into the end of the year. And I know that's one that Sean and other town officials have as well. And we just really have to wait and see what happens with that. But on the other side, you know, mother is, or was it the necessity is the mother of invention. We've had numerous businesses that have embraced new technologies or are doing something new because of this situation. You know, I've had retail businesses that have never had an online presence and have seen that, you know, they should have one. Either they're adding e-commerce to their current website, or they, in some cases, are building a website for the first time. I have other businesses that, because of social distancing, where they might, you know, they're a trade or a service business, they have to give some sort of estimate. They're now using Zoom or FaceTime or other technologies, so that, and they're seeing that not only are people reacting well to it, but it may be a new way for them to continue doing business in the future. It may be an additional service in some cases. So there's definitely silver linings happening. There's definitely businesses that are finding ways to adapt. And in some cases, I think that will change how we do business, in some for good, and some, we don't know yet. But there are a lot of silver linings, and there are a lot of good stories out there as well.
Thanks, Tracy. Great. I'm gonna. So, and I just want to point out this was last week's Mask Up event, and I was fortunate enough to spend some time there giving instructions and teaching people how to put on their masks. It was really a successful collaborative event here in the Upper Valley. So some different discussion points I wanted to go over, but first, part of the conversation that we haven't had yet is the other partners in our community, which are not-for-profits, and also healthcare, really feeling that they also had to not just feel, they felt the impact of this as well. It was just different kind of impact. So we saw hospitals. Now we have 2 hospitals right here in Lebanon, and in this district we also have another acute care facility down in Sullivan County, which is Valley Regional. Hospitals and medical practices made decisions right away as part of that, emergency response to minimize the, people coming in, with the exception of employees, putting the screening procedures in place. Visitors to hospitals were basically non-existent. Elective surgeries were temporarily stopped so that staff could be deployed to maybe address the surge, as well as if you want to bring anybody in that might be sick or could catch something and bring it to someplace else in the community. So we saw at medical practices, they were almost completely shut down. There were very few in-person visits at first. They accessed telehealth, and then we saw that they started to triage or choose who they were going to have come in and who they could see via telehealth. So we saw an uptick in that area. So I wanted to address healthcare quickly, but also we have, in downtown Lebanon, we have 2 arts and culture organizations. One is the Opera House and the other is the Upper Valley Music Center. Of course, we have the Ava Gallery, and we've seen some adaptations there because there was an impact on that in-person, going to see a show, going to take a music lesson, going to the art gallery for an event. That all changed as well. And you saw as Tracy, Kurt, and Josh all talked about different adaptations that they went through, and actually had to go through pretty quickly in order to to be nimble with the time so that we could still serve the public, do our business, or serve our members. So I remember talking to Ben Van Valley, who's the executive director of the Upper Valley Music Center, and he said that they were doing all of their music lessons through Zoom, and that they had maintained the same number of lessons before COVID, were still ongoing during COVID, and it picked up pretty seamlessly for them. I know that it's been harder for the Opera House, and we've been under renovation there as well, but Opera North in particular, they partnered with what's it called, Blow Me Down Farms, and started doing some free outdoor events. So we've seen some of those adaptations with our not-for-profit partners, as well as how this impacted healthcare. Okay, so talked about adaptation. I heard a couple of different themes related to that, or well, I heard about adaptation, but other themes, childcare, the availability of people to come back to work because they don't have childcare that's available to them, and that's still going on to this day. It's one of the opportunities we have moving forward is looking at childcare and early education, and maybe funding. We're one of 5 states in the nation that doesn't provide any support in that area and doesn't have an early, pre-K type of program. So is that a place that does not replace, parental or childcare, but is there an investment and a way that we need to look at this? Because in order to open the economy back up, people need childcare, or a place, or the children need to go back to school. So there are all of these discussions happening at the same time. And I also heard about the health and well-being of employees, people that either work for you or that you know, having screening procedures putting into place, needing medical guidance for those screening procedures. So taking care of your people is, equates to taking care of, being a good citizen and part of the entire community. I think that those are important adaptations and points to take away from this. So employees, employer relationships, impact childcare and early education, as well as everybody's ability to adapt. Before I talk about some of these other pieces and we take some questions, I've talked about this on previous Zooms, and I'm going to say it again. I think before we can, fully recover and open our economy, open our economy in a way that we're not just surviving, but we're thriving. We have a medical problem that we need to solve. And the common sense measures are what we have in place right now that are working for us. So common sense measures are, wearing the masks, and we've passed our ordinance. We've seen other Upper Valley communities partner with us. We know that this works. Washing hands and washing them frequently. We know that this works. Keeping our distance. I call it the no hug zone, but it's the 6 feet, and being really, really smart and vigilant about this is how we can all partner in the health and well-being of our community. At the same time, we have this public health capacity we need to pay attention to. Robust testing with a strong turnaround time. Contact tracing so we can isolate these spots of COVID and stop them right where they're at. And we know that we're moving towards a vaccine. We don't have one yet, and it could be well after the first of the year, but we have an opportunity right now where we don't have a vaccine to do a dry run. I mean, to solve the problem and open back up fully, we're going to need to keep these common sense measures, but we're going to need to solve the medical problem. Testing, tracing, vaccine. Seasonal flu, we're about to go into that season, and flu vaccine is going to become available. This is a great opportunity, and Sean, I'd be interested in hearing what you have to say about this, but this is a great opportunity for us to do a test run of our points of dispensing, which is part of our public health network's emergency public health response capacity, so that when we see a time where a vaccine for COVID is available, we have, basically done a dry run with the system that's already in place. So that is important for us to think about. Another piece of coming back to hopefully, opening back up is the use of something that's being developed, and even right here in the Upper Valley, which are therapeutics for prevention and for treatment. It's not a vaccine, but it will, this has been done before, and it could get us through, really help to get us through this time. So there's innovation and science happening in that area, which is very promising and exciting. So community partnerships, they matter. Common sense matters. In the city, we're monitoring our revenues. We know that the first set of tax bills came back, and it was pretty good. But what will it look like when we get to December? Broadband expansion. I think everybody has, we talked about this last week, and we're going to continue to touch on this because for years it's been a discussion. You need that highway to get where you're going. Now you need broadband. You're working at home. There's remote learning that's taking place, telehealth. We mentioned all of these things during this discussion, but we don't have this fully built out in our state yet. So there's a real focus. It's a real focus of mine. And you hear it from everybody that is either an elected official or wants to be an elected official. This is an infrastructure issue that, and really a right, a basic human right is what this has really turned out to be. And the lack of access to this is seriously problematic. And then the business adaptations that we've heard about tonight, the way people have gone from more of a brick and mortar to an e-commerce type situation. Restaurants have worked in our city and in others to move their operations outside. Everybody has really pitched in to help each other get through this time, but there's still some more work to do. So I wanted to take the opportunity to visit again with some of our panelists to see what they have to say about maybe what's next for them. And I wanted to start with our city manager, Sean Mulholland. Sean, what do you think about a dry run with the seasonal flu vaccine to get prepared? I've heard some talk about this in other states. What are you thinking about? I can't hear you. You're on mute. I'm gonna unmute you. A second. Unmute. Go ahead.
keep getting muted.
I would touch it. I'd try to unmute it, and then you'd try to unmute it. Sorry.
I think we're there. Okay. So we have a pod plan that we have tested before, we've exercised before. We're fairly confident that will work quite well. And if, obviously when a vaccine becomes available for the flu, this version of the flu for this particular season, that is going to be an opportunity for that. Most folks will probably go to their primary care providers like they need to get that. But we will have an opportunity to test that out even at a low level, no matter how that turns out initially. Who knows when we're going to have a vaccine to deal with COVID-19, whether that's going to be at the end of this year or the beginning of next year or sometime beyond that. But we feel pretty comfortable. We have a solid plan to be able to respond to that when it does become available.
Okay, great. Josh, I just want to talk to you. You had mentioned you've been able to keep a majority of your workforce. You have folks that are concerned about coming back to work. You've also seen an issue with not having childcare. Now we're going to move back into the school season. Any thoughts about that you'd like to share?
You got me off guard there.
Oh, sorry.
It's okay. Sue, I really hope we get some good news coming soon, because I don't see anything changing really until some good news comes with COVID-19. The people that we have who I miss dearly working with, like they simply don't have child care, and especially if their kids are only going to school part-time, if that might be the case. I'm not sure how to make that work. Yeah, that's not a great answer. I'm sorry, but
no. You know what? There's no perfect answer because this is uncharted territory, and there's a lot of uncertainty. So as we look towards the future, we can think about, okay, in a time when we're really not in COVID-19, this has shown us, this has uncovered what was always there, which is that we don't have funding for early education, that we could really bet. We saw childcare centers. There were 900 and something childcare centers in our state, and during the peak of COVID, it was down to somewhere around 200. So we have an opportunity here to think as a state about how do we want to address this moving forward. It supports, first of all, it's good for early education is good for children, and then we look at moving to the level of employment and daycare. It's good for the entire community. So we have an opportunity here to really rethink how we manage early education. So there are cracks that have come through, and this is our opportunity to look at those more closely and make some decisions about what we could do. There was an op-ed that Barbara Couch wrote, the Hope Foundation, to talk about that. The workforce. This is a foundational piece that is missing in terms of early education and daycare. So there's no perfect answer for it. You had just mentioned that you had seen a little bit of this, so I thought that I would ask you. Tracy, I wonder, do you deal with any folks that are in the not-for-profit sector? Do they partner at all with, I know you're the Upper Valley Business Alliance, but I work for a not-for-profit, and we do business just in a different way. So any thoughts on that?
Yeah, certainly. We have many nonprofit members in all different sectors, from human services to arts and culture type of nonprofits all throughout the Upper Valley. Childcare was actually identified as an issue prior to COVID for our region. We don't have enough childcare, didn't before COVID. It's going to be an issue as we move forward. Just as you said, with possibly, children not going back to school, early childhood care is an option. I've heard stories of people who have babies, and even before they have the babies, they are enrolling them in daycare centers, and looking for a slot. And this situation is just going to exacerbate that problem.
Okay. Kurt, you've had communications difficulty, but you talked about early on that you're able to make this adaptation and that you have a different customer base, that animals, still need to be fed. And so, what do you think about as you move forward? Or, you've got this in-person presence now. Are you going to keep this kind of like curbside service and, do business more the way that you're doing it now into the future?
We will continue to, I guess you can't see me, but we'll continue to do the curbside service without any question. Childcare has been an issue with us as well. It's had quite an impact. We've are trying to deal with that. Can you hear me okay?
Yes, can hear you great.
Okay, all right. One of the big issues that hasn't been brought up is the unemployment. We've had situations, and I talked to many fellow business owners who it pays for someone to stay home, and they're incentivized not to go back to work because of the unemployment compensation that they've been receiving. That's a real problem, and hopefully going forward, there's a way to find a solution that will enable and encourage people to go back. For example, one thing that I thought would be good is for every 20 hours of unemployment you get, you should give 5 hours of community service. So we can get people to feel good about what they do and incentivize them to go back to work as well. But it's like Josh, like all the others. I mean, it's a real concern what's going to happen going forward. It's the unknown. It's the new norm. And certainly from our perspective, we struggle trying to find help. I have 8 openings right now, and we're losing a lot of seasonal help that's going back to school, to college. But we've had other people that said, I'm just not comfortable, even though our numbers are low. They aren't comfortable going back to work. So maybe a collaborative work with Tracy and her great organization to do employee sharing. So if we have someone that say we get into a slower part, we could lend our employees to another fellow business and vice versa. I mean, it's all about working together. And I think that's been on the forefront for us. We've come up with a number of programs, from the hand sanitizer and giving New Hampshire Innkeeper and Restaurant Association a check for $5,000. We sold the mask. We sold actually over 1,400 masks at our store. We've given $2,500 to Humane Society. We've given $500 to actually $1,000 to other groups. We've given $8,000 out so far, and more that will be issued next week. I think at the end, the last thing I want to say about this is every Thursday morning we have a staff meeting. Everybody's required to be there. And we always tell them there's 2 words we want them to practice: patience and compassion. And I think as a business, we have to be compassionate towards our customers, obviously, and our staff, but we also have to be compassionate to fellow businesses. As a consumer, as a member of the community, I have to encourage people, remember that businesses like Salt Hill and Three Tomatoes and a lot of these other businesses are here for you and doing everything they can. And it's not just the struggles that we all have now. We've been there. The small businesses and the responsible businesses in the Upper Valley have been there supporting the community. We just need to make sure that the community continues to support those businesses, especially now.
Excellent point. Thank you, Kurt. Okay, everybody, we have a couple of questions. So first one is my friend Ellen. How are you? She says, first, thank you to the town and businesses for being available to the community. I was so excited to eat at Salt Hill in May when we could come up onto the mall. So her question is, what has been the state's level of support? Sounds like town governments were helpful to local businesses, but how has the state and the governor's office helped the towns? And then there's a question for me in that, but first we'll start there. And I think we heard some of this, especially with Tracy talked about, the Main Street Fund, payroll protection, any other pieces. And I know, Sean, we got some funding from the CARES Act that came all communities. There was $40 million that was split up between the different communities, but there's also some money from the Department of Justice, and I'm trying some airport funds. So anything that you, either of you have to add to that?
Obviously, there's the monetary pieces, but we had the mayor and I had a phone call with the governor every Thursday morning, and we brought up a number of issues, and the governor has acted on quite a few of those. Actually, one of them is to allow cities to enter into tax payment programs with property owners, which we're not actually allowed to do until the property becomes subject to deed. Normally, people would pay an 8% interest rate. The governor issued an emergency order that allows us to enter into tax payment programs immediately with property owners, and we're charging 1% interest on that. And that we have some property owners that have availed themselves of that, although not that many in our particular city. But that was a big change that's not allowed under the law, and the emergency order allowed us to do that. The governor also allowed us to conduct meetings through electronic means, as you saw. There were quite a few, without getting in all the details, there are quite a few changes that we asked for that he implemented pretty quickly. One of my other jobs is I'm the chairman of the board of directors from the New Hampshire Municipal Association, representing all the towns and cities in the state. And we, the city of Lebanon, were in a good position to advocate for the things that we need and those other cities and have a direct connection with the governor's office. He was pretty responsive in his staff to most of the things that we had asked for. So he's done, in my view, a pretty good job in that regard.
Okay.
I would add to that New Hampshire has done a great job in getting relief monies out quickly, which not every state, some of our neighboring states have dragged their feet a little bit in terms of getting those relief funds out to their nonprofits and to their businesses. New Hampshire had a very quick turnaround for it.
Mm-hmm. Okay, thanks. And so part of Elle's question is, does Sue see how she can assist Lebanon from Concord? And what would this look like? And I'd be thinking about the whole Connecticut River Valley. There's a few things. I think, the number one thing is that there's that, again, we talk about that medical problem that needs to be solved. And although I can't, I'm not going to be creating a vaccine, I feel that, one of the first things that we need to do, again, make sure that we need to make sure that the public health networks are supported. This is how public health is, a large part of it is delivered in our state because we don't have individual town public health departments. So these networks are essential to this. We need to be ready to distribute the vaccine when it becomes available through these points of dispensing. That's part of what needs to come through in Concord. I think, attention to this issue. We've heard everybody talk tonight about childcare, early education, how this was an issue pre-COVID and it is an issue during COVID, and it's going to be an issue coming out of it. So what have we learned from this? How can we properly fund this and make this so it's working not just for the families, but for our entire communities? I also think, Ellen, we need to really we need to beat the drum about broadband, because broadband plays into, everybody talked about the different adaptations that they've made, but a number of them have to do with online ordering, e-commerce, people working from home. And what we know is that this information highway does not exist universally. I think one of the things that we're going to need to do is something like we've done in response to when we had, we're at and we still have this in place, we're at the peak of the opioid crisis. We put what we called, or people refer to as a drug czar in place. And so we're going to need to have somebody that is, the leader on this and, shepherding this process through so that, we don't see December come or past that and the conversation with broadband fall down. Folks in Concord that are serving you, and I've heard everybody, really speak loudly of their commitment to the expansion of broadband. So it's something that's important to me. I've heard others talk about it. We now, again, we've seen this crack in the technology. This is our information highway, and we've shown how we need this for everyone. So I would be really pressing to move, at least in those three areas, to get started. Okay, so one more question, and I know we always run a little over, and I apologize that, but I love how people stay and have good questions. So this is from KS, said, I saw a poll from the New York Times that 50% of Americans wouldn't get a COVID vaccine if one became available. What should we do about this? Well, that's a really good question. What do we do about it now when people don't get a vaccination? So vaccinations, they should, I mean, to me, it's common sense. It's about community well-being. I think, if I'm reading this right, and from what I've heard, is that that people are concerned that maybe, are we moving too fast? Do we know that this vaccine is going to work? They have a concern about the vaccine itself and are thinking about not taking it. I don't know how the state, the public health departments, the public health networks, as well as, um, you know, doctors' offices and businesses are going to respond to this. I know that when I worked in at least 2 different hospitals. There were certain vaccinations that I had to have in order to work there. And if I didn't have them, I had to sign a form that said that I, declined, and I basically, was waiving any of my protections related to this. But then when we moved forward through H1N1, that changed. If you didn't have it, imagine this: if you didn't have the vaccine, you could still do the decline form, but you had to wear a mask. And that was a big deal. And now we wear masks when we go to the grocery store. So how things have changed. So I don't know what the exact answer is, but I think we're going to need to have a conversation, not just at the state level, but with the medical community and with the business community, and what's going to be the right approach to this. Will we approach it like we approach it like we've approached other vaccinations as they've become available? I'm not sure exactly what will happen, but I can understand why folks are concerned. The health and the well-being of the community is at the top of the list, that we all have a role to play in that. And I think that as you're talking with your friends and families about this, you should, that should be part of, I know it's part of my conversation. I hope it's part of yours. So I'd like to wrap this up tonight by thanking all of our different panelists. So Sean Mulholland from the City of Lebanon, Tracy Hutchins from the Upper Valley Business Alliance, Kurt Jakes from West Lebanon Feed and Supply, and Josh Dewey from Salt Hill. Everybody has had a really interesting perspective, and they've been able to tell their story about what the impacts are. Let us remember again that these common sense measures, wash your hands, wear a mask, socially distance, those are tools we have right now. Let's solve this medical problem. Let's continue. Let's be part of solving this medical problem. Let's continue to work together. And I'm going to leave it there. We will not be having a Zoom town hall next week because I'll be participating in a Q&A with the Hanover and Lyme Democratic parties. But the week after, which is the 27th of August, Dan Weeks from Revision Energy is going to be with us, and we're going to talk about some of the local ways that we have addressed climate change, especially one in Lebanon through a partnership with Revision Energy. But we'll also be discussing how, like statewide policy, and we're going to be talking about our pathway forward. So I'm really excited for that town hall with Dan. So thank you again, everybody, for joining us. Have a, put your mask on, wash your hands, safe distance, and have a great week and weekend. Bye-bye.
Thank you.
Thank
Yeah,
you.
thank you.